Hi, I'm Sunny Hatch. I'm an Osler Scholar in the John P. McGovern Academy of Oslerian Medicine. And today I have the privilege of speaking with two mountain climbers, Dr. Lemuel Abibabu,
Very well done. Impressive.
who's a pediatric infectious disease specialist and professor at UTMB Galveston. He's also an Osler Scholar in the John P. McGovern Academy of Oslerian Medicine, as well as the chair of the Academy. And also a professor and pediatric otolaryngologist, Dr. Harold Pine. And Dr. Pine is also distinguished in the Academy as having received the Oslerian Medicine Excellence in Clinical Teaching Award not once but three times in 2013, 2016, and 2019.
Yeah.
And most people would think, well, why are a bunch of physicians sitting around and talking about mountain climbing? So, Dr. Pine, in 2015, you decided to take a trip to Nepal. Is that right?
Yeah, Nepal is a very special place to me. I got engaged there many years ago, did my first honeymoon there, and I was looking for a way to go back. So I decided to put together a team of doctors where we would go to Nepal and walk up to the Everest base camp in the same path and footsteps of Tenzing Norgay and Edmund Hillary back in 1953. So I got a group of 12 of us together, and the idea was that as we would move slowly up the mountain, we would help take care of people. And we had nothing extremely organized, but we just knew, because I had been there before, that there's always people that need help. And so the big majority of our team flew over together, and I'll never forget this. We arrived in the visa hall about 5-10 minutes after the plane landed, and all of a sudden, the building started to shake.
It was an earthquake, I understand.
It was a huge earthquake. Now, we didn't know it at the time, but interestingly enough, all the Japanese folks that were on the plane with us scampered out of the building, and the only people left were us Americans thinking, oh, this is great, the visa line just emptied out.
Yep.
But it became very clear quickly that it was an earthquake, and we were kind of jovial about it, but we didn't realize at the time that this thing was massive and ended up killing something around 9,000 people across the Kathmandu Valley, killing something like 20 people at Everest Base Camp where we were going, and immediately just changed the whole flavor of our trip.
Yeah.
We obviously, eventually, much later in that day, made our way into Kathmandu and could start to see the piles of rubble everywhere. And it became a real dilemma for our team as to what do we do now. And some of the team left because they were getting frantic calls from America, from their loved ones, saying, you got to get out of this place.
Yep.
You know how the media has a way of making things sound worse than they are.
Yeah.
But some of the team did stay. And what ensued was an amazing thing. I ended up having about 6 or so climbers stay, and we wanted to help, right? I had this big first aid kit with me, and a bunch of the other climbers that had left all their tools and equipment. So we had amassed a ton of stuff, but we didn't know what to do with it. But we had boots on the ground. And so literally after a breakfast one morning of rice and hard-boiled eggs, we basically just started walking around Kathmandu. And we came across this giant field where clearly there were Nepalese army officers and soldiers out on the field, and hundreds of people that had amassed. So I walked over there and I figured out who the officer in charge was. I explained and I pointed over there. I said, I got a group of doctors from America. We've got some stuff. We'd love to help. And so the Army guy was stoked. He's like, bring him over. And he planted a big Red Cross flag in the grass. And he's like, you guys set up shop here and I'll bring you the patients. And so over the next number of hours, a huge line of local Kathmandu folks started coming through our little aid station. And it was the walking wounded stuff, right? Bruises, scratches, cuts. We had one poor lady that was dizzy, and I had an otologist on the team. So he went through his whole rigmarole on how to evaluate dizziness. But it felt good. It felt really good to try to do something helpful. And then we obviously canceled the Everest trip, but made our way to other parts of Nepal that weren't affected. And during that time, places from all over the world were sending help. Yeah. It was really cool. And I have connections to Israel and their rapid force that goes all over the world to help people. And so there was an otolaryngologist on their team. Wonderful. And I was able to connect with this guy, and he said, why don't you come help me? He had gotten sick on arrival in Nepal with some bug and was stuffed away in his tent and couldn't function. So when we showed up, they were like, okay, you're gonna go work in the ER tent. And within 5 minutes, they had us seeing patients. And I brought some of my climbers with me. And so to be able to help the Israeli army was just an amazing experience. And it set the stage for our team. I call our team the Everest Medical Expedition. Yeah. But when we left that year, we knew we wanted to go back. And that sort of set the stage for what we ended up pulling off in 2017, which I think was just totally epic.
Very true.
Tell us about the trip.
Trip was amazing. I would say Harold is like, hey, Lam, I'm going to Nepal. Do you want to go? And I'm like, sure. What we doing? It's like, just get ready. Well. And I showed up, just like you said, all packed up. And lo and behold, there was the earthquake. And just like Harold said, I probably got, 20 phone calls that night from my wife, family members, everybody is looking for me. And I spent maybe about 3 or 4 days. Harold stayed a little bit longer than I did. And I think the most memorable aspect of it was actually walking around, like you said, Kathmandu, going through different local hospitals where we're offering help. There were kids, I'm a pediatrician, so I was more inclined to help out the little ones, and the rest of the gangs were doing, whatever we could to help everybody out. I would say we spent, half a day or mostly the whole day, just going from makeshift, hospitals outside, outdoors hospitals as much as we can.
You guys even worked in a school trying to get them up with different computers. Is that right on that trip?
No, that was a different trip. That was the next trip. That's actually more fun, actually. And so, after about 3 days, we're like, what else do we need to do? We've helped as much as we can. We gave up pretty much all the supplies that we brought. If you remember, some of the folks that left earlier left their snacks. And so we basically walked around, they were handing out snacks to whomever wanted some snacks. And then finally, I think about day 3 or 4, I'm like, okay, I'm heading back to the US. And Harold actually stayed for a few more days and spent more time helping out, and I guess I chickened out. But he did say, hey guys, we're going back, And so 2 years later, this time we actually had a bigger thing, right? It was a much bigger group. It was 25 climbers. More than half of them were physicians, but we also had people from ITs, as far west as California, down south to Puerto Rico, Costa Rica, and then Canadians and a few, how far did we go? Basically, we're all over the place. And the team came up again like, okay, guys, we're going to do this. And this time we decided we would kind of, I guess, foster or, if that's the right word, if you want to foster a school or maybe adopt a school. That's, we end up adopting a school. So the IT guys from California made connections and came up with 25 computers, laptops, and different, equipment to be able to furnish the school with a laptop. They've never had a laptop or computers in this school before. Mm-hmm. And then those of us, the medical guys, were like, okay, we're going to provide all kind of first aid kits, medication supplies, internal medicine, dermatologists, ENT, ID, whatever. Whole group were together. And so that was that was the plan. And Harold was in charge. He had everything organized. He had, the contact in Nepal, and everything was planned. All we had to do was just show up, So the whole thing was his plan, and everything went perfectly well.
But I understand then you went to Mount Everest, is that right?
Yes.
The base camp was there?
Yes.
Yeah. So this trip was designed to be part medical mission, part personal adventure. Yeah. And statistically, for the people that start the Everest Base Camp trek, I would say about 70% make it and 30% don't and have to turn around for various reasons. So you can imagine my trepidation. Here I am feeling responsible for 25 climbers, thinking, how am I going to get this whole team up to base camp?
Looking about people from as young as 18 years old to as old as 60 years old, the group was very mixed, it was a nice group.
You mentioned about how do you do it, and I would imagine there are many factors that come into play when someone's about to climb at an altitude like Mount Everest. Could you guys speak to that, about like diet or medical conditions? What else?
Well, a lot of people ask me, what does it take? And I pretty much think if you're motivated and in decent shape and can walk for about 8 hours a day, this is an adventure for you. The unknown that gets people is the altitude. And the thing is, you can't really train yourself for what's going to happen at altitude. Now, I suppose it's easier for those that live in Colorado. They're already a little bit acclimatized. Right. But we're talking about walking at 17,000, 18,000 feet. And it's hard to prepare for that unless you sleep in a hypoxic tent, which now people do to pre-acclimatize before going to climb actually to the top of Everest. But for this trip, I think it pays to be in good shape. Right. It pays to shed unnecessary weight, which when I did that, it made walking so much easier, right? Every pound of fat you take off reduces the amount of pressure on your knees tons. So I found it so much easier when I shed some of my baby fat.
Yeah.
So I imagine there's the psychology of the climb too, is that right?
Absolutely. Absolutely.
It has to be. For me, going back to, getting back in shape, what I did, I'm like, hey, what do I need to do? How do I need to get in shape? It's like, oh, you're in shape, you don't need to worry about it. I'm like, no, I'm not. So what I did was I walked the stairs at John Seeley every morning, 2-3 times a day, 10 flights of stairs every single day for about a month. That, I didn't think made any difference, It made me feel good that I could do it, but I don't think it actually helped that much in terms of, acclimatizing.
You have bonding experiences too, I would guess, as a team, is that correct?
We did. It was, we all had at least one roommate each. And at the same time, we also had a group of us. I wouldn't say group, but there was maybe about 4 or 5 groups within the group, if that makes sense. They were the fast trekkers. There was about 4 of them, including Harold, that were like always in front, which was the good thing about this trip. Then there was those of us that were like in the middle, maybe 4 or 5 of us that were like, just taking our time and taking pictures and enjoying the the sceneries. Then there were those that were a little bit less, I would call them slow trekkers. But the good things was we were all within 20, 30 minutes of each other. You know, it wasn't like somebody was 2 hours away, but we're all mindful of, hey, you stop here, you wait for your group, you know, everybody comes in. So that bond, you know, was growing among, you know, the different, within the group there was that bond, but overall, the dynamics within the group was excellent. I wouldn't trade it for anything else. Everybody seems to get along perfectly well.
It sounds like a great experience. You know, I know you guys have done many other climbs than this, and I guess Kilimanjaro was also one that was very special for you guys along the bonding experience.
Kilimanjaro was basically half of the same team that went to Mount Everest. It was what, six of us, seven of
Yeah.
us, and it was a last minute thing. This was all planned within 3 months. You know, Mount Everest took what, 6 months, maybe longer. It was like, hey, I'm going to Kenya for a medical mission work, but by the way, we can go hike Kilimanjaro. And it's like, sure, let's do this. So it was like a group of us, the physicians, did both the hiking and the medical mission. And then those that were non-physicians just did the hiking. And then when, you know, but that bond is there that whenever we all meet or speak to each other, it's like, hey, look, when next are we going on an adventure, you know, trip? So although we do call it, you know, climbing, to me, I consider it to be an adventure. You get to have a bond with your climbers. But you also develop a relationship with somebody in the town or in the city or in the village or something like that. And you also get to give something back to the community. You're taking something from them by actually going to their place and, you know, sightseeing. But in return, we always, you know, Harold taught me this, you always make an effort to give something back. Could be just 4 hours or 8 hours of medical mission work. Or it could be, you know, setting up a school with computers or something. But there's always going to be that give and take. And that's something I actually cherished the most about my entire trip, was being able to give something back in return, getting something from wherever it is that we're going.
Yeah. Kilimanjaro is always going to have a super special place in my heart, because when I was a second-year resident, I took my baby brother to climb Kilimanjaro, and he video recorded my slow decline into what turned out to be cerebral edema. And in retrospect, I'm lucky to have survived that trip, but I didn't know any better at that point. And for anyone that's interested, there's a YouTube video out there. Just look up Harold Pine Kilimanjaro, and you can see what bad altitude sickness can do for you. So that was the start of my adventure career and my interest in adventure medicine. And you know, since that point, I've tried to learn about altitude sickness and recognize the signs. I mean, near the top of this mountain, I couldn't even open a bag of peanuts because I couldn't use my hands. I had become dysarthric. I could barely walk. And it's amazing I got off the mountain. One thing that bothered me for years, and anybody that's been to Kilimanjaro knows this, there's a famous sign on the top, right at the summit, that says, "Congratulations, you made it to Uhuru Peak." Yeah. It's something like 19,300 feet. But my brother never had a picture of that sign. And so it always made me wonder, even though they said I was at the top, I think what they did was tricked me and decided this guy is out of it. Let's just tell him he'll never know the difference, and let's get off this mountain. And so when we went back together, deep in my heart, I wanted so bad to see this sign. And so to get up there to the top with our team was really a remarkable experience. And you know, these kind of climbs, these crucible events are probably just as much mental as they are physical, right? Your mind starts playing games with you. And I have all sorts of tricks that I've used over the years to sort of keep me going, right? I use little mantras. Nathan on the right, James on the left, Sophie in the front. Those were three of my kids. Now I have little Wolfie pushing me from the back. So when you can accomplish these things, all of a sudden you think, wow, I just did something that I didn't think I was going to be able to do. And so it opens up the world to you. You start thinking, well, what else can I do that's challenging? And so I have found these events really remarkable for just keeping to push us to keep striving to be better.
It's said that climbing the mountain is similar to achieving one's life's and career's goals, you know. To be successful, I guess climbers must be skilled and patient, no matter what obstacles you're coming across.
I think patience, I mean, skillful, I'm not so much sure about skillfulness, but being patient, it's a big task. Give you an example. When we went to Tanzania last year, was it last year? It was February last year, right? And I think I ended up having a stomach problem. You know, I had H. pylori on the last 2 nights. And then the last night we woke up, 2 o'clock in the morning, midnight, I can't remember. And we were hiking. And then towards the end, the last hour, I was completely out of it. You know, couldn't move, couldn't do anything. But these guys keep pushing me on. Keep, like, hey, come on, Lim, you got it. You're right down there. You know, somebody took my backpack, just to make sure I make it to the top. And they got to the top, waited for me, and I could hear them singing my name and calling my name. Yeah. And I made it to the top of the mountain. It was like, wow. Without these guys, there's no way I could have made it, So that patience that they had for me to get up to the top of the mountain was unbelievable. It's something that I would cherish for the rest of my life.
Hollywood has had several films about this, but one of the recent ones was Free Solo.
Yeah.
It was an American documentary that profiled a climber in quest to performing a free solo climb of El Capitan in Yosemite National Park.
Right.
And of interest is the New York Times review of that movie says the film is less about climbing than it is about living.
Yeah.
Do you agree with that?
100% agree with it. Yeah. It's you set a goal, and it may take a year, 2 years, 10 years, but being able to achieve that goal, it's something that it's indescribable, and then being able to do with a group of friends that you actually cherish and you trust, it's,
But you have to be disciplined, I would think.
You have to be disciplined, yes. You have to be dedicated. You have to be determined.
James Whitaker has been quoted as saying you can never conquer a mountain, you can only conquer self.
Correct.
And determination, it sounds like there's an underlying theme of determination here.
Certainly.
Okay, and problem solving and critical thinking, which I think might be a little muddled when you have cerebral edema. But
Well, that's a very valid point, because that's exactly what happens, and that lack of frontal lobe judgment goes out the window at altitude, and that's why it's really important when you start to do these kind of climbs at altitude that you have a plan in place. Yeah. And certainly for real expeditions that go to the summit, they have base camp managers who are at a reasonable altitude, who are thinking clearly, that basically kind of have the final say to the climbers up there to say, hey, look, you're past your time limit. You need to turn around now. Yeah. And you can imagine just how tempting it might be to just be hundreds of feet away from a summit for something that you've spent a lifetime dreaming about, and then to have to turn around. And that's what takes the real discipline, to say, the mountain will be here next year, and to save yourself. But there are plenty of examples of people that didn't make that decision, and they paid with that decision with their life. And certainly Everest is one of these famous mountains where there are bodies still littered along the way of people that succumbed up there.
We talked about patience, we talked about discipline, determination, problem solving, perseverance. But these are all also qualities that William Osler talks about in Equanimitas.
Yes,
right?
It is. Exactly.
Raymond Green is an endocrinologist, and I want to read to you some advice that he once gave a patient. He says, you shouldn't put so much emphasis on your work. Only second-rate people do that. And then, of course, their work eats them up. Whereas they, of course, ought to eat up to eat up their work. My work would eat me up, but I would keep it in its place by climbing mountains. And climbing mountains makes me a better doctor. You
I
agree
would
with that?
100% agree with that. It's one of my goals to at least go either hiking or climbing something once a year. And that's what I consider to be my time, meaning I'm completely out of the medical field. I'm completely out of the mom or the dad's, picture. And I'm in the wilderness with a group of friends and we just wake up in the morning, enjoy the beautiful weather, the clean air and just relax and enjoy what nature has to offer you. You know, I definitely agree with that. It's something, for some reason, it's almost like getting my battery recharged. After climbing and you come back and you get back to work and you're ready to go again. It's like you fully charged up and you can handle whatever stress comes around. But towards the end of the year, it's like, okay, I'm getting tired. I'm getting,
Well, burnout's real in
yeah,
our field, and a lot's been
exactly.
brought to our attention lately, especially about burnout. But you have started a new wellness program in residency.
Yeah.
And could you tell us a little bit about that? I know you co-authored some papers, but it's called The Second Mountain.
The Second Mountain program, yeah. Well, I've crowned myself our departmental wellness champion, and I am always looking for cool ways to sort of move the needle on that. I know burnout is real. I feel some of it myself. So we've started for our department, but we are now rolling this out around this campus, what I call the Second Mountain program. And really it's a human development wellness program all rolled into one. And fundamentally, when I talked to my residents about this, I said, look, I want you to just pick something outside of medicine that you want to start. Have the courage to suck at something new. Pick something and work on it. We talk about ENT being our first mountain, but it's important to have that second mountain. Yeah. And so what I did was I gave each of my residents this patch, which was supposed to symbolize their sort of commitment to a life of self-mastery, right? But as they go about and conquer their different second mountains, they get to earn different rocker patches in the various different areas. So what are the 5 mountains? And I didn't make this up. I borrowed this from Mark Devine and the Unbeatable Mind program that I trained with. I mean, this guy's brilliant, former Navy SEAL guy, and he made me understand the importance of training in an integrated way, right? It makes no sense to spend your entire life just climbing the academic ladder, right? The intellectual ladder, right? How many people do you see around here that are intellectual geniuses but have the emotional IQs of an infant, right? I see people that are physically strong here, but emotionally they have a ways to go. I see people here that by all means seem to be extremely accomplished, and yet you can tell they have trouble connecting with others. So I believe that when you can integrate your training along the physical path, the mental path, the emotional path, learning to tap into your intuitional heart, and then finally, and this is a rocker patch that only my chief residents can earn, because you have to be good and train in these other mountains before you can earn the Kokoro patch.
The spirit.
The Kokoro patch is exactly that. It translates heart in Japanese, but really what it means to me is melding your heart and your mind into action, preferably in the service of others. And so I have tried my best to lead my life here at UTMB with the idea that I want to be an honorable man but in the service of others. And sort of having that framework really allows me to tolerate all the daily challenges that pop up here for us.
You're extending the concept to the Senate, I understand.
I just became the Faculty Senate President, and yes,
Congratulations.
I have tried to tell our leadership that we are going to have a theme this year of wellness, and I have offered this program. I've given the patches to each one of our faculty senators across all 4 schools, so they too now can pick a second mountain and start climbing.
Sounds phenomenal,
Impressive.
really.
Very impressive.
Let's bring this back to Osler.
Okay.
William Osler also recognized burnout in the
Yes.
field.
Yes,
And
he did.
he is quoted as saying this in The Student Life, written in 1905. Every day do some reading or work apart from your profession.
Yeah.
I fully realize, no one more so, how absorbing is the profession of medicine, but you will be a better man and not a worse practitioner for an avocation. I care not what it may be, gardening or farming, literature or history or bibliography, any of which will bring you into contact with books.
Yes.
Thank you for listening to our segment today. And remember, always to practice medicine with your head, your heart, and your hands.
UTMB Health, working together to work wonders.